Welcome to another episode of Reach Prevention of Targeted Violence podcast, where we delve into different aspects of violence prevention through enlightening discussions with community partners and experts. I'm Andy Martinez, your host and a team member of the Reach Project. I'm thrilled to be here with you. The topic we want to explore today is mental health promotion as a preventative measure against violence. Promoting mental health initiatives within communities offers individuals healthier coping mechanisms and reducing the risk of engaging in harmful actions towards themselves or others. By addressing underlying mental health issues and fostering resilience, communities can create safer environments and reduce the likelihood of violent incidents occurring. Joining us today is Dr. Shawna Scully. Dr. Scully is a neurologist who serves as the Chief Medical Officer of Emergence Health Network, the federally appointed local mental health authority in El Paso, Texas. Dr. Scully, thank you so much for your time today. Can you tell us a little bit about yourself?
Well, I'm a prior Army physician. In the military, I served as a board-certified neurologist with specialties in brain injury medicine. And then now I've transitioned into the community sector, more the public sector. And in that capacity, I'm working with the local mental health authority and the local intellectual and developmental disabilities authority to help optimize the services that we provide our population, to collaborate with partners in the community to build safety nets under these clients, and to do everything we can to sort of optimize their health and well-being so that they can function more to the benefit of the entire community. And it's a neat challenge, but I really love being a part of it.
Thank you. In your opinion, what are the key barriers or challenges to implementing mental health promotion efforts in violence prevention?
I think there's two. The first is a complete and utter lack of awareness of the concerns that these people face. You know, when people have mental health disorders, an understanding of what they're experiencing can help to interpret their behaviors in a way that do not trigger violent responses, not just from the client themselves with the mental health disorder, but from, say, the police or the fire or the border patrol or just the general public who encounters them decompensating. It's amazing how many times someone with a mental health disorder is subjected to violence because people didn't understand what they were experiencing or what they were trying to express. I think the other thing is just challenges regarding resources. Now, the last Texas state government boards that approved bills did a nice job of expanding funding for mental health concerns. But even that's a drop in the bucket compared to the needs that are being expressed right now in our communities. So expanding resources and expanding awareness to combat ignorance would be an incredible opportunity to support these people.
And from your perception, what are some common and misconceptions about mental health within communities?
I think the biggest misconception is that people don't understand why the word health is in mental health. When someone has behavioral health concerns, they are frequently by society interpreted as being weak, having a poor moral compass, lacking integrity and insight, when really they truly are ill. This is a healthcare concern. And if we addressed it that way, we would develop treatment programs as opposed to social persecution programs that would really help to sustain and support them to the point where they could regain their status as valued members of our community. So I'm looking forward to the point where we can really wrestle with these concerns from a medical perspective and engage them from that place of compassion and really show why the word care is in healthcare with these clients' concerns.
How can we address potential stigmatization or resistance to mental health interventions?
I want people to imagine in their minds. I want you to take a piece of paper, and on one side of the paper, I want you to write the word them. And on the other side of the paper, I want you to write the word me. And then more towards the them side, I want you to draw a really big circle. Now, way over towards the us side, we're going to draw a straight line down that clips off just a tiny edge of that circle. So it's like I've just sliced a really tiny piece off of that circle. And then what I want you to do is in the big circle, I want you to write their issues. You can put issues, problems, whatever you want. And then in that little tiny sliver on the us side, the little sliver of that circle that's left and is on our side of the line, I want you to draw a little arrow to that and write what we truly know about their issues. It is a lack of communication, a lack of compassionate awareness and understanding that leads to the vast majority of these barriers. And every time I have gone into a heated situation, a conflict, let's say it's a person with intellectual and developmental disabilities who gets put in jail. Or let's say it's someone with bipolar disorder who's a single parent who pulls their child from school and then gets called in front of the school board and the council. It's easy to judge based on that little sliver of what we know about their life. But if we took just a brief pause to get our finger on the pulse of their issues, their situation, and the thought process that led to their decision making, we frequently would have a far more compassionate understanding of their experience and an ability to create new opportunities for them to express and to engage in ways that are more able to be supported by the community around them. And it's really, we think we know, and what we know is such a small fraction of that experience that we're really not making the informed decisions that everyone involved deserves. So that's my 2 cents on how to overcome barriers induced by stigma, is just take the time to get to understand.
Thank you. What simple everyday actions do you believe individuals can take to promote mental well-being within their own communities?
I'm going to respond to that with a quote. I do not know who said this. I've tried to look it up and I cannot find it. The answer is always unknown. But I heard it coming from the mouth of Maya Angelou, the celebrated African-American author. And she was quoting it in one of her interviews. And what she said was this: kindness without honesty is manipulation. Honesty without kindness is brutality. So if we had that blend of kindness and honesty in all of our engagements, I think we would generate a far more positive environment for healing to take place, not just for the individual, but all of society.
So negative thoughts can spark violence when they fuel feelings of anger or frustration, leading individuals to lash out in harmful ways. What strategies do you recommend for managing negative thoughts or emotions when they arise?
Well, I tend to approach very complicated situations, such as multiple people with very heated emotions in the midst of some kind of conflict. I find that if I take a minimalist approach, I can sometimes make more sense of all the different lines of thought that are coming through. And I sort of divide all the emotions that are being expressed around me into one of 2 categories. Is this expressing love or is this expressing fear? Now, a lot of people will say that there's a million more emotions than that. Yes, I get it. But if you really boil it down, jealousy is just fear that someone might be better or have more than you do. Greed is just fear that you don't have enough. And kindness is a form of love. Respect is a form of love. Affection is a form of love. And so I just try and put them into those 2 camps. And I usually find that most of the discontent is coming from the fear side of that line. And so I look at that and I start trying to figure out, how do I speak to that fear? And in all honesty, the best way to speak to fear is with love. When you engage that, you can counteract pretty much any negativity that you encounter, but you have to define love. And in my background, and I know we're talking social sciences and violence and we're thinking technical, but I'm talking touchy-feely. But when you think about love, if you define that as the perfectly balanced engagement of both respect and affection for the people that you're engaging, you're respecting them, you have kindness and compassion for them, You are also respecting yourself and having kindness, compassion, and affection for yourself. You create an environment that is safe for people to engage. You aren't letting them run all over you because you have respect for yourself, but you're also respecting them to the point that they feel what they have to say is being heard and appreciated and is being woven into the overall solution that needs to be generated. When you can take that approach, you can break down just about any conflict as long as all sides are willing to engage, again, with respect and affection. It's not always possible, but when it's done, it can solve problems that everyone else thought were just entrenched and just a scar in society.
Thank you for sharing. That's actually really interesting. I'm going to switch gears a little bit and ask what strategies you believe are most effective in promoting mental health as a means of preventing violence within communities.
I honestly think the most important thing you can do is educate. If you educate the community and the institutional structures about the needs and the various presentations of those with mental health concerns may come with, you can actually start talking about meeting their needs as opposed to talking about how do we marginalize them and exclude them from society. How do we incorporate them to bring the gifts of their unique perspective as opposed to ostracize and then lose the benefit of their engagement? I mean, it's amazing how many people with serious mental health disorders are incredibly talented artists, musicians, even theoretical scientists. And when we engage them from that perspective of respect and affection, we can benefit from the gifts that they bring. The second thing we need to do is educate the community and institutional structures about the available resources. Let them know who in the community can provide support, who can give counseling and therapy, who can give medications, who can create a home, who can link them with a food bank until they get back on their feet, those sorts of things. Because right now we see them as chaos in our lives, meaning someone with mental health disorders. But if we gave them support and structure, we could stand back and see them turn and give us so much more in return. It would be part of a community. That's something that is lacking. People are not educated about how to connect these people with resources. And so frequently, even though they may mean well, they just put up their hands and walk away because they don't know what to do. And then let those with mental health disorders, let them know that there's hope. Steadily link them with therapy, support services, needed resources, medications when required. Do what you can to help them reclaim their lives. Because right now it is their disease that is making their decisions, and we need to get them back in the driver's seat so they can make their decisions. I mean, when fear makes your decisions, you tend to drive into a wall. When anger makes your decisions, you tend to drive into a crowd. What if they made compassionate and informed decisions and steered around all of those issues towards a brighter future? Those are the things I'm looking forward to. And then the last thing is we need to be very clear about the goal behind provided needed support. The plan, again, is to help them control their own lives and then weave a safety net underneath them so that they can maintain that control and then allow them to engage society in a manner that is productive and informative.
Thank you. I really liked what you said about supporting them instead of isolating them. I also want to ask how we can tailor mental health promotion strategies to address the diverse needs of different communities and populations affected by violence.
There are two ways to do that. Number one, and I know this is a buzzword to the point that it's almost burnt out, but social determinants of health. If we understand, again, part of that big circle of their issues, if we know whether or not they know that they're going to have a roof over their heads, or whether or not they're going to be sleeping in a car with busted out windows in a really bad neighborhood, if we know that they have a chance at getting a meal, if we know that their insurance didn't stop and so they now no longer have access to their meds, if we know the social determinants of health that create the framework in which their mental health then exists, we can better understand what's going on. So studying those through active research, not just assumptions or biased, prejudiced, perceptions. It's actual study. The more you know what that looks like, say, in the very unique bilingual border metroplex of El Paso that has a 35% poverty rate, very limited medical literacy, very limited access to care. Half their care is across the border, half their care is here. The more you understand that for your community, the more you can build solutions that will meet their specific needs. You don't want the federal government coming in and telling you what the answer is when their solution may work really well for inner city Chicago or the docks in New York, but will not work here. We can take their ideas and we can learn from them and adapt them once we understand the true needs of this region. Because we are unique, we're brilliant, we're beautiful, we are a border metroplex. But if we don't study ourselves, we won't know how to best engage these processes. So that's the first part, study. The second part, very simple, just shut up and listen. Listen to what the client thinks they need. And yes, sometimes you will get answers that don't make a lot of sense because they're coming through the lens of a mental health disorder. For example, they may totally lose their mind because somebody gave them crunchy peanut butter when they wanted smooth. Well, when you're autistic and you have sensory disorders, that's important. It's not a priority for many of the rest of us. But if we actually listen to what is of value to them and incorporate that in our decision-making process as we build programs to support and sustain, we're going to build things they actually want to use as opposed to feeling abused by. Because sometimes the cure is worse than the disease. And so if we build an informed cure or an informed engagement approach, it will be far more well received and engaged and acted upon.
Thank you for sharing that with me. And now I'm going to ask if you can recommend any resources for individuals that they can use to support during their mental health journey.
The beauty is that these days there are now resources just about everywhere. I mean, my own agency, Emergence Health Network, we have over 28 sites all throughout town. We're supporting everyone from those with intellectual and developmental disabilities to veterans, to those with substance use disorders, to those who are having an acute crisis and just need a day or two in a stable environment to pull their life back together. Counseling, therapy, short-term, long-term, we have everything that they need. And we have fiscal support programs that help to make that a possibility for them, even if they are living in that burnt-out car with broken windows. But there are so many other resources. If you're in the middle of a crisis, dial 988, just like 911, goes to a local switchboard with national resources and connects you to immediate emergent help. But even then, just in your day-to-day life, I would challenge them to reach out, and I would challenge us as members of the community to be that resource. Teachers, clergy, coworkers, social support workers, all of them should be informed enough to be able to listen, understand, and help link these people with support. And then think about all the amazing support agencies in this area. Project Amistad, the food banks, the hospitals and healthcare agencies, they have expanded to the point where so many of these needs can be met if just that crucial first link between them and the support service is made. And then once that's made, all the agencies really work to partner so that, for example, you come to me with a mental health disorder and you also have a medical concern. Well, I'm going to reach out to one of the low-income, no-income clinics in town and try and make that connection. You also have substance use disorders. I'll reach out to a substance use clinic in town to get you supported along those lines if you need inpatient care. And you don't have transportation to get there, I'll reach out to Amistad and they'll connect you with the transport services to get the help you need. That follows with a bus ride back to the food bank and your home. We've just met a huge number of your needs by, as a community, linking our hands and using them to support and sustain these people who are at risk.
How you think schools, workplaces, and other community institutions can contribute to mental health promotion efforts.
Real simple. Number one, be aware. Be aware of what's going on in the lives of the people around you. Don't be nosy, but be aware. And when they're not right, when they're not good, let them know you're there to help. Number two, be informed when they are having a hard time, or even when you're having a hard time. Know where the resources are, how to connect with them, and how to make sure you get the need addressed before it becomes an emergency. And then the last one is really, really simple. Just care. Literally just care about the world around you. Because when you do that, you can be the resource that people need, and then you yourself feel less isolated, more engaged, more involved, and more valued. It'll help your mental health to support the needs of someone else with mental health concerns.
What partnerships or collaborations do you think are necessary for effective mental health promotion and violence prevention efforts?
In all honesty, it just takes every single one of us who are being willing to care. I know we're not all at our best and we can't be there every single day. And I don't want to create a codependent society that runs around sacrificing yourself to meet the needs for others. But if we just took a moment every day to think about how I can do one thing that is meaningful for the world around me, if every single person did that for just literally took one step every day to make the world better, I don't think we would live in a lot of the chaos that we live in right now. And so really what I need is for all of us to care. That's what's going to make the difference.
Well, thank you, Dr. Scully. I really appreciate your time here today.
Thank you.